What do you need most at this very moment? A good education? A good job? A career? Money? Every individual sets out goals that are important to him or her. Some are short-term, and others long. Yet not one of these needs is as important as one blessing you possess at every moment. Breathing. It has been 39 seconds since this film began. If you had been unable to breathe for 39 seconds, you would have given up all you owned in order to be able to breathe again. In another minute or so, you would have lost consciousness. Brain death would follow in another 2 or 3 minutes, and your life would be at an end.
Pneumonia is the result of the body's reaction to respiratory infections caused by bacteria, viruses, mycoplasma, and other pathogens. The infection causes an increased secretion of fluids and shedded cells to pour into the passages and air sacs of the lungs. The presence of exudate within the air spaces of the lungs causes the coughing, shortness of breath, and fever associated with pneumonia.
During normal respiration, air travels through the nose, down the trachea, and into smaller and smaller airways called bronchi. Bronchi divide into bronchioles and finally into tiny grape-like clusters of thin, fragile sacs called alveoli. Chronic obstructive pulmonary disease, or COPD, refers to a group of diseases that cause airflow blockage and breathing-related problems. Emphysema is a disease that destroys the alveoli and the alveolar ducts. As your lungs lose elasticity, the alveoli rupture, creating large air spaces that reduce the surface area needed by your body to absorb oxygen and remove carbon dioxide waste. Bronchitis is the inflammation of the lining of your bronchial tubes. Chronic bronchitis results from the persistent inflammation of these airways. Mucus is continually produced, and over time the lining of the bronchial tubes become thickened. This restricts the flow of air during breathing. COPD is caused by tobacco, asthma, exposure to air pollutants in the home and workplace, genetic factors, and respiratory infections also play a role. During normal respiration, air travels through the nose, down the trachea, and into smaller and smaller airways called bronchi. The bronchi divide into bronchioles, and finally into tiny grape-like clusters of thin, fragile sacs called alveoli. In alveoli, oxygen is exchanged for carbon dioxide in the blood. Bronchiectasis is an abnormal destruction and widening of the bronchi due to recurrent inflammation or infection. This results in the airways becoming abnormally enlarged. Extra mucus tends to form and pool in the enlarged airways. The small hairs that line the airways, cilia, are also damaged, affecting the patient's ability to rid the lungs of dust and germs. Because the cilia no longer function properly, the pooled mucus is also difficult to clear. Lung infections are common. A person may be born with bronchiectasis or may acquire it later in life as a result of other lung disorders. The main symptom of bronchiectasis is a constant cough that produces a lot of phlegm and mucus. Although the patient generally feels well, without fever or pain, fatigue, weight loss, shortness of breath, and wheezing can also be present. Bronchiectasis can be treated in a number of ways, including antibiotics and chest physiotherapy.